Hi everyone, Dr. Theirl here to talk to you today about vitamin D. Now listen, vitamin D has been getting a lot of press in the last decade, really, even more so year by year in this most recent past year, in terms of its importance for immune boosting, specifically cancer. It's also very important for autoimmune diseases, most often noted for multiple sclerosis. So, vitamin D is an antioxidant. It's a fat-soluble antioxidant. It's very cost-effective to take, and I prefer it in a liquid form over a powder form. It's a great way to boost your immune system. It also helps build bone health. So vitamin D has to be on your topics in terms of what it is you want to take, and you want to do it on a regular daily basis. That having been said, what else can we look at that's new and different in terms of vitamin D specifically for your own physiology? You want to do an annual blood test and look at those vitamin D levels in your blood. And those ranges typically go anywhere from 0 all the way up to 100, and they can go beyond 100. Depending upon your own health history and your own risk factors for things such as cancer and autoimmune diseases, you're going to want your range in different levels, and that's going to be very much based upon your own health history. But your genetics play into this as well. And there are new genetics tests available that are salivary versus blood, meaning you just have to suck on a little paper disc and put it back up to the lab versus actually having a blood drawn done, that look at 3 markers. The first marker is an enzyme that converts inactive vitamin D3 into active vitamin D3. You need a good function of that enzyme. The second marker is carrier proteins to actually deliver that active vitamin D3 to your different cells. And the third portion of that is the actual vitamin D receptor, so that when that vitamin D3 shows up at your cell, you can bind it well and the vitamin D3 does what it's supposed to do. If your genetics are stacked against you to have suboptimal or greatly deficient functions of that enzyme, those carrier proteins, and or that binding receptor, you're going to want to do a very good job taking your vitamin D3 supplementation on a regular basis and follow your blood levels and make sure that they're adequate depending upon your own history. I hope that gives you some additional insight onto vitamin D3 research and what's going on, coupling your own specific genetics so that you can have much more personalized medical and health care coming your way. All right, thanks so much for tuning in. Dr. Theirl, go ahead and subscribe to our YouTube channel so that you get all these great 2-minute updates. Thanks so much and have a great day.